Hey everyone, this is Mike, and today I'm going to talk about using logotherapy beyond the first three sessions. Now, I did a video on logotherapy for the first session, and for sessions 2 and 3. This is now going to be the ongoing session for the remainder of the time. The only one that I might have an additional session on is like closure, but we can talk about that moving forward. So, I want to preface this by giving you an example. So, for logotherapy, I want the focus to be on the talk being meaning and purpose focused talk the entire rest of the therapy session. And I'll give you an example of what I mean. So, I'm going to talk about person centered and then a version of solution focused brief therapy for a second. Just those two things, just to kind of give you a context. So, for those of you that remember, in person-centered, what Roger says is that the conditions for therapy are sufficient are necessary and sufficient for growth and change and improvement. So in person-centered, the conditions are a accepting, non-judgmental environment, the therapist being authentic and congruent, right? There's a few quote interventions, certain questions and clarifying, but basically a lot of it's reflecting back, paraphrasing, summarizing. So it's very kind of taking yourself out of it as much as possible, but creating an environment of warmth and safety and support, so a person's true, authentic self can come out and they can confront aspects of themselves that they might otherwise be scared of, and they can kind of understand and accept who they are and see changes where there might be changes to be made. And the idea is that the process, this creating this environment and conveying certain attributes as the therapist and interaction with the client, that process is the intervention. You don't have to do anything beyond. There's no like homework, like in CBT, there's no mood logs or things like that. There's no, like in behavioral activation, I want you to do these 3 things between sessions. The process is the intervention, right? Now, of course, in person-centered, they believe that these are necessary and sufficient conditions. Most people these days don't believe that in person-centered it is necessary and sufficient. They believe it's necessary, having this congruence, this authenticity, this non-judgmental, accepting attitude, this place of warmth and safety and support. But it's not sufficient. But again, we're not talking about person-centered right now. I just wanted to give the example that the process is the intervention. Now, solution-focused brief therapy by Sager and Insuberg and a few other proponents of it, they have a history of it. You could look it up. Where you look for exceptions, and you look in the future, and what are some of your outcomes and goals, and those kinds of things. How do you do that if they were upset? Like, how exactly did you do that? What were you thinking? And then you could do some other thinking. And again, a lot of it is looking for the exceptions. There's another take that's similar. It's kind of an outgrowth of solution. It's still solution focused, but the idea is your entire conversation is outcome focused, your best hope focused. So a person has their best hopes, their outcome, happy, peace of mind, right? That's their ultimate outcome. Confident, that's their ultimate outcome. And then the entire rest of the therapy session is focusing on confidence. How do they feel confident in general? What were past examples of them being confident? What would the future look like if they were confident, right? What did they notice about themselves? How are they different? How are they thinking, acting, talking, dressing, moving? And by triggering those thoughts in the person's mind, the brain starts to tap into that. This is when we were confident in the past. Right? That's the history of our being confident in these times. How do we know we have that confidence today? How is it conveyed? How do we, why do we even think we can be confident? Well, there are reasons why. We talk about it. Imagine you were this way tomorrow or next week or at that next presentation. How would you be different? How would you? And the brain starts going there. It starts picking up those places in your brain, and you almost start to feel it, to be it, to live it. Sometimes you can even see a person sitting up straight. But again, you don't need to do anything beyond that. The talk, the outcome, best hopes talk, that's the intervention. right? You don't need to do anything beyond it. You don't need to say, well, I want you to step into that confidence and imagine you were in that presentation and you're stepping into the confidence. NLP does that, right? They say, I want you to tap into that confidence and really feel it. You can feel it in your shoulders, your back. How do you feel? How are you thinking? Now, imagine you're on a date or you're on a job interview and you're stepping into that confidence. The solution focus doesn't even say that. You don't even need to do that. It's just the talking about the outcome, the confidence, right? The peace of mind, the happiness. That in of itself is going to trigger things in your brain and in your memory, and it's going to stimulate it, and you're just going to start to feel empowered. You're going to start to feel the outcome that you want to feel. The intervention is the process, right? So I'm now going to apply this to logotherapy. We're talking about meaning and purpose. That's the process for the remaining therapy sessions, and the process is the intervention. So anytime they're coming to you with a problem, what's the meaning you can get from this? What's the meaning what is a meaning that you can derive from this? Even in terrible things, there's a meaning and purpose that we get from it. Frankl did that with the Holocaust. There's something that we can get. There's some learning, some meaning, something that we can benefit ourselves from. So you can ask a person, what is the meaning they want to get from this session? What is the purpose they'd like to have as a result of talking today? What are some meaning and purpose things that you've experienced in the past? How did you know that meant your meaning? What do you mean by meaning, right? What did it feel like when you had a meaningful moment? It doesn't have to be a whole thing, but a meaning and when you recognized you had a purpose. Just talking about a meaning and purpose focused session. So every question, there may be a few filler questions in between, but most of the focus of the therapeutic discussion is meaning and purpose based and meaning and purpose focused. Every question, more or less, is, well, what's the meaning you get from that? Have you had some experiences of meaning before? How were you different? How did that meaning make a difference in your life? How would this, if we could find meaning in this, how would this change you? What difference would this make to you? What difference would this make to the people in your lives? Now, you can still use Socratic questioning. You can still use de-reflection. What meaning can you give to other people? How can you help others? How can you find meaning in doing for others? You can also use paradoxical intention. What if you were able to face your fears? If you were able to confront that anxiety, what meaning would you derive from being able to do that? How would that make a difference in your life? How would you be better? Right? What would other people notice in you? How would it better their lives? So you can still use some of the logotherapy techniques of paradoxical intention and de-reflection and Socratic questioning. You can also talk about the meanings. How can you create meaning from this? How can you find meaning that already exists but kind of cull it and pull it out, right? How can you gain some acceptance, right, from it? How can you think about it differently in a way that you can derive meaning and feel like there's a purpose to even to suffering? But again, the whole rest of the therapeutic sessions after the first couple is meaning-focused, meaning-based, purpose-focused. Every question, except for a few filler questions in between, is about meaning, meaning, meaning. How are you getting meaning from this dilemma? How is this crisis? How can this help you find some meaning? What meaning can you find in this? Now, let me just step back for 1 second. Obviously, if a person's in immediate crisis, if they've lost a loved one, someone died, you don't immediately say, all right, what meaning can we get from this? You may need to be there with the person just as one human being to another. So it's, you don't have to kind of jump in immediately. It's what the person needs. They may just need someone to talk to, another human being to kind of sit with, right? You don't always have to do anything. A lot of times, if people are religious, they don't always necessarily need God to do something. They just need to be with God, or whatever spiritual belief you have, or in nature. They don't expect nature to do anything, but just being one with nature can feel okay. So there are times when we can just be with each other. But most of the time, you want the focus to be meaning and purpose focused. And every question is going to have some connection to what meaning and purpose can we derive from this experience. Okay? I hope that's helpful, and I look forward to seeing you next time. Bye.